this 1 hour webinar on gastroesophageal reflux disease. I am Dr. Luis Abola. I am board certified in internal medicine and gastroenterology, and at the same time, the medical director of Multicare Pharmaceutical Philippines. Just to explain what gastroesophageal reflux disease is. Ang Gerd, no, gastroesophageal reflux disease. So, ibig sabihin ng gastro, stomach, esophagus, yung daanan ng pagkain. Reflux, ibig sabihin bumabalik yung acid from the stomach. So, this is when reflux o pagbabalik ng contents ng stomach that will cause troublesome symptoms and some complications. Okay? This just shows you, this is a representative sample of what happens in your stomach. So, this is your diaphragm, and the diaphragm, so the diaphragm helps to close the junction of the esophagus in the stomach to prevent the contents of the stomach from going back sa especially yung acid. Ito yung itsura niya. So, makikita. Okay? So, normally, pag hindi tayo kumakain, sarado yung junction yan ng stomach at ng esophagus. Ngayon, sa ibang tao, nagre-relax yan kahit na hindi kumakain, kaya bumabalik yung acid. Ang stomach natin is protected against acid, pero yung esophagus hindi. Kaya pag bumabalik yung acid sa esophagus, nagkakaroon ng injury, tsaka nagkakaroon ng symptoms. Okay. So, ito yung pwedeng mag-cause. Ito one of the causes bakit nagkakaroon ng reflux. So, these are the causes nag-lower yung pressure. Ito yung natawag na lower esophageal sphincter. Yan yung nagsasara ng stomach and the esophagus. Some acidic fruit juices and tomato-based foods. Of course, alcohol consumption, peppermint, if there's forceful abdominal breathing, no, especially in obese patients. Diets high in fat and carbohydrates. Some medications, kung babasahin nyo ang side effects na may cause reflux, tapos smoking can also cause reflux. The following are the risk factors for developing Gerd. Okay, so as I mentioned, certain spicy foods and citrus, chocolates, alcohol. It can be genetic, so it can run in the family. Obese, no? High waist-hip ratio. Okay, obesity, pregnancy, very common yan in pregnant women, lalo na pag malaki na ang tiyan ng buntis na pasyente. Sleep deprivation, kasi it can cause stress. In fact, a lot of my patients now with Gerd are BPO employees. Ang common signs ng symptoms ng Gerd is yung tinatawag na classical heartburn. Ang heartburn is kaya tinatawag na heartburn kasi parang nasusunog ang parte ng tiyan nyo na malapit sa puso, no? Classic burning feeling, parang mahapde. Or tapos umaakyat sa leeg, pati sa bibig, tapos nagkakaroon ng maasim na panlasa sa bibig. Ito madalas mag-burp o dighay ng dighay. Dysphagia, ibig sabihin masakit pag lumunok. O dinophagia, ibig sabihin masakit pag lumulunok. Constant hiccups, no? Pagsisinok. Pwede rin nagsusuka o nasusuka. Or nararamdaman nga bumabalik yung kinakain o yung maasim sa bibig. Pero may mga symptoms rin na extra na hindi kasama sa esophagus. So pwede ring chest pain, chronic cough, no, ubo na ubo. Pwede rin siya mag-trigger ng asthma attack. Pwede rin mag-cause ng pagpapamaos, no, papamaos dahil sa yung acid nakaka-harm sa larynx o dun sa voice box natin. And it can also destroy our teeth, no, dental erosion. So, ito yung may ibang symptoms, lalo na pag sa mga bata, pag madalas mag-chest pain o palagi inuubo, ang isang kinoconsider ko ay nagre-reflux sila. Ang next ay warning signs. Kasi, pag tinitingnan namin yung pasyente, titingnan namin kung pwede ba namin gamputin na lang muna bago gumawa ng ibang mga procedures. So, ito yung mga warning signs na tinahanap namin kung may signs ng dumudugo, no? Pag dumudugo, kunyari, sumusuka ng may dugo or dumudumi ng dugo o kulay itim na ang dugo. kulay itim na ang dumi niya. Siyempre, kung masakit ang dibdib or parang nasasakal or nahihirapan lumunok o masakit ang paglunok, siyempre, kung nawawalan ng timbang, no? Unexplained weight loss. Sabi niya, kaya na ako ng kain, pero nawawala rin pa na ako ng timbang. Paano namin dinadiagnose ang reflux disease? Of course, pag may classic symptoms, tinitingnan namin ano response to medication. So kung medyo bata pa, tapos mukha talagang heartburn, bibigyan mo namin ng gamot, tapos titignan namin kung nag-respond. Kung di naman, ang pinaka-common namin ginagawa ay endoscopy or gastroscopy. May papasok kaming tubo sa bibig para umabot sa tiyan para ma-assess yung esophagus. Ito mas sumusunod, yung x-ray, hindi na masyadong ginagawa, pwede gawin. Yung pH monitoring at manometry, nagagawa lang ito sa mga very special hospitals. Okay, so may mga gamot na ginagamit, pero hindi ko muna i-discuss yan. Ito yung mga pwede natin gawin, no? Pag may GERD o palaging hindi nawawala yung GERD natin. We should avoid certain types of food, pero para sa akin, tignan nyo rin kung ano nagkukos ng symptoms. Pag may nakain kayo o nainom, lalo nagkukos ng symptoms, avoid yan. So fatty food, chocolates, citrus drinks, spicy food, tomato-based products, coffee, tea, soft drinks. Avoid eating at night. No? Avoid lying down immediately after eating. Avoid tight-fitting clothes, so tight-fitting pants. Pag palaging nag-GERD, especially sa gabi, nakataas ang ulo sa pagtulog, so baka 2 or 3 pillows. Wag hihiga agad pagkatapos kumain. No? Siguro mga 1 or 2 hours before you lie down after eating. If overweight, you have to lose weight. Of course, restriction of smoking and alcohol. Huwag masyadong kumain ng madami. Huwag bigla, no? Huwag biglang madaming kakainin. So, pwedeng small, frequent meals. So now, alam ko, at ito yung mga pwedeng complications ng GERD. Ito pag palaging merong hindi nagagamot na mabuti. Pwedeng mag-aspirate, ibig sabihin, yung pagkain pumupunta sa baga. Yung Barrett's esophagus is complication ng GERD, pwedeng maging cancer. Pwedeng maging strictures, ibig sabihin, liliit yung daanan ng pagkain. Pwedeng dumugo, pwedeng mag-perforate, mabutas, o pwede rin mag-precipitate ng asthma attack. So, ito para sa Thanksgiving, pero ito rin yung para ngayon na naka-quarantine tayo. 1, schedule an earlier meal sa gabi. Wag para may time kayo bago kayo higa. Stay active. Avoid smoking. Avoid taking the juice. Wag masyadong spicy. Limit alcohol drink. Pass on deep frying of food. Use smaller plates para hindi masyadong madami kinakain. So, imbes na soda, tubig na lang inumin. Huwag masyadong madaming kakainin. In fact, huwag masyadong ma-stress. Huwag matutulog agad pagkatapos kumain. Siyempre, kung hindi nawawala ang symptoms o lumalala ang symptoms, you should talk to your doctor. No? You should go see your doctor or see your gastroenterologist for proper management. So we can accept now questions. There are any. So from Bernice, my aunt due to her post-menstrual syndrome, she experienced mild to moderate panic attacks only when unexpected happens. Heartburn, nausea, and mild discomfort. It's okay. Plus, as a first-line management rather than monotherapy PPR antacid such conditions. This will depend on how old your auntie is. Kung may symptoms siya, before giving medications, I would also try, if over 45, I would always suggest doing endoscopy. Pantoprazole with domperidone can be given for first-line management. The best time to give these types of management is to give it 30 minutes before breakfast. But ideally, kung matagal na nagkakaroon ng symptoms, tapos yung over 45, I would recommend also an endoscopy. In medicine, when we say distal, it is farther from the mouth, and proximal is nearer the mouth. So pag sinasabing distal esophagus, yan yung parte ng esophagus that is near the stomach. Proximal stomach is the upper part of the stomach. So in medicine, in anatomy, when we say distal, it is further from the mouth. Proximal, it is nearer to the mouth. Okay. Ang recommendation pag in treating GERD patients is actually 1 month. It is from 4 weeks to 8 weeks treatment. So, especially if they are relieved after 2 weeks, I would recommend continuing this for another 2 to 6 weeks. Kasi that is the recommended duration of therapy, which is 8 weeks on PPIs. Ngayon, kung hindi gumagaling or kung may recurring symptoms after taking the medications, we can do endoscopy to evaluate the esophagus. And second, pwede siya i-maintain, no? May maintenance therapy, which means pwedeng being on the medication for 6 months up to 1 year, or what we call on-demand therapy. But ang GERD, as I always tell my patients, no, GERD will always recur. Kasi when we're treating GERD, we are lowering the acidity of the stomach, pero nagre-reflux pa rin sila. So, kaya lang hindi sila naging symptomatic kasi pag nakagamot, bumababa na yung acidity ng stomach, kaya kahit na nagre-reflux sila, walang symptoms. Pero palagi siya magre-recur unless may lifestyle modification. Pag lifestyle modification, ibig sabihin, yung mga sinabi ko kanina, no? Stop smoking, stop drinking too much alcohol, avoid taking heavy meals, try to find out what food or drinks triggers the symptoms, and avoid that. So hindi lang pwedeng gamot lang, meron dapat changes in lifestyle also. It depends on the age actually, no? And other circumstances. Kunyari, 40 years old and above, may hypertension, may heart disease, may hypertension, may diabetes, chest pain. Tapos kasabi ng chest pain, parang nahihirapang huminga o madaling mapagod, I would consider first a heart disease. Eh kung bata pa siya, let's say in the 30s, tapos active naman, and the chest pain has been there recurring, tapos tells me that it occurs especially after eating, I would still try first on medications. But if I am still considering heart disease, I may opt doing a electrocardiogram, chest X-ray, or even refer to a cardiologist for proper evaluation. Most often, yung mga pasyente pumupunta sa akin may chest pain, galing na sa cardiologist. No? Nire-refer yung na-check up, na-work up ng cardiologist, ang nakita nila yung chest pain hindi dahil sa puso, and nire-refer sa mga gastroenterologist for further evaluation and treatment. Yes. Doon sa slides ko kanina, yan ang ibang tinatawag ng extra esophageal symptoms. Kasi yung acid, pwede pumunta sa loob ng baga at yun magti-trigger ng asthma. Kaya kami, minsan pag may chronic cough, no, ubo na ubo, parang inom ng gamot para sa ubo pero hindi nawawala, start rin namin ng PPIs, no, para mawala yung ubo. Tapos minsan mapapansin namin yung asthma, ang isang nagtitrigger ng asthma pag nagre-reflux. So again, kadalasan yung mga ibang pasyente galing na sa kanilang mga doktor na tinitreat for asthma pero parang hindi gumagaling, nire-refer rin sa amin sa GI to evaluate, tapos inuumpisa na rin namin ng gamot. Kasi kahit na binibigay ng gamot para sa asthma, kung palagi naman nagre-reflux ng acid, hindi mawawala yung asthma. So they are related. Yes, I think it can be given, but normally, pag ganun, I would wait first for clearance from my OBGYN. So I will tell my patients to get a clearance from their OBGYN kasi madalas nga sila nagkakaroon ng symptoms. Tapos, pero in general, as far as I know, yung mga PPIs are quite safe to give in pregnant patients. Ang home remedy, one is drinking water in fact. Kasi pag uminom ng tubig, pina-flush out mo yung pina-flush out mo yung acid from the esophagus, no? Tapos yung iba, I would recommend antacids, yung mga over-the-counter antacids. Tapos I would tell them to as much as possible avoid eating fast, no? Huwag masyadong mabilis kumain, huwag masyadong madaming kainin, at huwag rin hihiga agad pagkatapos kumain. So dapat nakaupo, no? So those are the things you can try. Tapos pag hindi nawawala or nag-worsen symptoms, of course, still recommended to see your doctors. um, yan ang problema pag masakit ang tiyan. Pag masakit ang tiyan, madami ang pwedeng causes, no? So, siyempre pag nagko-complain ng masakit ang tiyan, kukuha kami ng history, titingnan namin kung anong klaseng pain na nararamdaman. Kadalasan, pag gallstone ang problema, ang nararamdaman ng pasyente is pain sa right upper part ng abdomen, no? Just underneath the ribs, the right side. Lalo sumasakit pagkatapos kumain, lalo na kung mamantika o matataba ang mga kinakain, tapos dighay ng dighay. Ang difference dyan is pag GERD talagang ang nararamdaman ay nangangasim sa may dibdib, no? Nangangasim, mahapde, may nararamdaman umaakyat na acid sa bibig. Tapos kadalasan, pag may GERD, nagigising sila ng madaling araw, mga 3 to 4 in the morning, nagigising kasi habang natutulog tayo, maraming acid kahit na natutulog, ang katawan natin nagpo-produce ng acid, so umaakyat yan at early morning. So yan ang isang symptom na palaging hinihingo sa pasyente kung nagigising sila mga 3 to 4 in the morning. Kaya pag gallstone, yung sabi ko, ang pain nga is hindi burning pero mas makirot, hindi mahapde, nasa right upper area ng sikmura, tapos mas madalas sumasakit pag kumakain ng matataba o oily foods. Okay. May mga studies dati lumalabas about complications, no? There are studies to show that giving the PPIs for 1 year continuously is not bad, no? But we are not recommending a prolonged use, no? In my practice, I give them for 4 to 8 weeks the active treatment, then mga 6 months maintenance therapy. Then after that, if they are asymptomatic, pag wala nararamdaman, I stop the medications, but I instruct them na pag bumalik yung symptoms, they can start the medications for another 2 weeks and 4 weeks. Pero I do not like giving them for a long period of time. Kasi, pag bumabalik palagi yung symptoms, mas gusto kong silipin rin yung tiyan. Normally, I would recommend every year magpa-endoscopy para makita kung anong itsura ng esophagus. Tapos, siyempre, encourage ko rin yung lifestyle changes, no? Yung sinabi ko kanina. Okay. Depende kung ilang taon, no? Pwedeng pag mabilis kumain, no? Yung eating habits, pag mabilis kumain, tendency na sa swallow ng air din. Pwedeng may anxiety, no? It can be an anxiety issue kasi pag may anxiety, lunok ng lunok, no? So dapat observe kung lunok siya na lunok, swallow in air, it also force will go out. And type of food that you're eating. So, sometimes you have to evaluate baka non-gastro yung problem. It's it may be an anxiety, tapos diet, and the way she eats. So, just observe how she eats. So I would recommend not eating too much, not eating drinking too much soda, also chewing your food well and not eating fast rapidly. No? Yes, they can try, of course, yung mga PPI should be under yung mga proton pump inhibitors are prescription products, so they should be evaluated first by a physicians. But there are antacids and other medications to relieve the symptoms. But depends on the age also. If as I said, no, kung over 45 kung over 45 ang patient, I'd recommend uh, um, consult with the gastroenterologist, because that we may have to do endoscopy to make sure that there is nothing more serious than what is presenting. So, pero pag bata pa naman, tapos hindi naman ganun kasakit, tapos it's not that recurrent, you can try first the over-the-counter medications. But if it is not being relieved by your over-the-counter medications, you should consult your gastroenterologist.
We can still take another question. Doc, paano po kung nawala na ang simptomas ng pangangasim after makumpleto ang pag-take ng medication, pero meron pa rin parang may nakabara sa lalamunan na mahirap lumunok? Sintomas pa rin po ba ng GERD yun? Dapat ko din bang ituloy ang pag-take ng pantoprazole?
Kung ganun pa rin ang symptoms no, after taking the medications, first thing is you have to go back to your doctor. Kasi baka pwedeng kasi pag nagkakaroon ng reflux, nagkakaproblema sa may lalamunan. So baka kailangan tignan yung lalamunan mo either by a gastroenterologist or by an ENT. Kasi yan ang one of the complications na pag masyadong na-injure na yung dyan sa lalamunan, it can cause some strictures. So I would suggest after nawala na yung ibang symptoms ng GERD pero meron ka pa rin parang tightness sa throat, masakit lumunok, dapat magpatingin ka, pwede, kung hindi sa gastroenterologist, sa ENT, para meron silang mga gamit na pwedeng silipin yung lalamunan mo. Yes, that is part of the guidelines. No? If they do not get better with one PPI, you can change it to another PPI. Okay, ang complications ng GERD, pwedeng magkaroon ng strictures, pwedeng magkaroon ng ulcers rin sa esophagus. Pag strictures, ibig sabihin magbabara yung daanan ng pagkain, so hindi siya makakain. Of course, ang long-term effect there is kung hindi nahihil ang reflux, it is a risk factor for development of cancer also. So that's why we're very aggressive in treating gastroesophageal reflux disease kasi it is a risk factor for the development also of cancers. So yun ang complications. No? Pwedeng ulcers, strictures, isa nagbabara, pwedeng mabutas kung gano'n kasama ang injury. Of course, pwedeng magka-cancer, pwede ring magkaroon ng recurring asthma. So those are the possible complications. As I mentioned, no, pag may GERD, normally treatment is from 4 to 8 weeks, yung acute treatment for GERD. Now, after the 4 to 8 weeks, I will evaluate the patient. If they do not develop, if they're asymptomatic already, they feel better, I will stop the medications. Now, if they do come back to me, na sinasabing pag huminto ng gamot, may symptoms pa rin, I will start them again on medications. I will tell them, no, you can start the medications, take them for 1 or 2 weeks. If you get better, stop it. And then, just continue. Pero, dapat, obserbahan rin niya anong nag-trigger ng symptoms. No? Kasi kahit na inom ka ng mga gamot, if you're not changing your lifestyle, no, you're not changing your diet, dapat i-identify mo ano ba nagkukos ng symptoms ko. Pag may kinain ba ako, may ininom ako, or yung activity ko. Pag ganun, it's better that you also modify your lifestyle, change your diet, and then start on the medications. Kung talagang symptomatic pa rin, I can go up to treating them from 6 months to 1 year. Yung tinatawag na maintenance treatment. Or pagkatapos doon, may tawag na on-demand treatment. Ibig sabihin, binibigay lang sila pag may symptoms sila. Depends, but there are medications that can cause GERD symptoms. Kasi may mga medications na nire-relax yung upper esophageal, yung lower esophageal sphincter. Especially yung mga antihypertensives, yung mga calcium channel blockers. Yun, nagkakos yun ng reflux. Tapos you have to check your medications. Read the paper, the product information sheet, and sasabihin sa iyo kung merong side effect ng GERD. But there are medications that can relax the lower esophageal sphincter pressure. Okay, there's no food that will neutralize the acid. Remember, our stomach secretes acid. No? That is a normal physiologic process. The acid, once we eat or as we are preparing to eat, our stomach secretes acid to help in the digestion of the food. So, what is proper is to make sure you eat on time. No? Do not skip your meals. Drink enough water. Do not take so much food at one sitting. Avoid eating fast. Kung may symptoms, the only way to neutralize the symptom, the acid in your stomach, would be to take medications like antacids, as well as the other prescription medicines such as the proton pump inhibitors. But there really is no food that will neutralize the acid. Kasi the acid is as I mentioned, it is a normal physiologic process that is needed for digestion. It also protects us from harmful bacteria, no? Kasi yung mga kinakain natin, pag madumi, pwedeng mapatay yung mga bacteria with the acid in our stomach. Pag ganyan, I would assess yung gallbladder. So I would do an ultrasound, either an ultrasound of the abdomen para makita ko yung gallbladder mo kung may stones. Do some blood workup, liver function test, tawag doon. Or kung na-ultrasound ka na, the next step will be to do a CT scan of the abdomen. To assess talaga if your symptoms are really GERD or a gallstone disease. If you're of a certain age, I would even do an endoscopy also to make sure to evaluate the esophagus. Yung reflux disease, there are two types of reflux disease. No? May tinatawag na erosive esophagitis. Pag erosive esophagitis, pag nasilip na yung esophagus, nakita namin may injury sa esophagus. So tawag doon erosive esophagitis. Pero meron tinatawag na non-erosive esophagitis. Pag non-erosive, ibig sabihin, may symptoms ng heartburn, may symptoms ng GERD, pero normal ang esophagus. Pwede mangyari yon. So yan ang workup pag may parang palagi may symptoms, hindi nawawala. No? So we will do an endoscopy, at the same time do an ultrasound to assess the gallbladder, kung if the patients can afford, I would go to CT scan of the abdomen already to assess properly yung mga structures sa liver, gallbladder, pancreas. Marami, no? Pag sa matanda, tapos burp ng burp, I would refer to a neurologist kasi pwedeng merong neurologic cause ng consistent burping. Next, I would assess the gallbladder kasi that is one of the common symptoms ng gallstone disease, no? Ng bato sa gallbladder, yung dighay ng dighay. No? So may parang hangin palagi kinakapag. So those are the two things. No? I would refer to a neurologist And I would also evaluate the gallbladder for possible gallstones. Okay. Ang endoscopy o gastroscopy, ginagawa namin para mag-diagnose o mag-rule out ng more serious disease. Kasi, so that's why nililimit namin yung endoscopy to the older patients. So, 40 to 45, we're becoming more aggressive. Pag mas bata pa doon, unless na walang warning symptoms, no? Sinabi ko warning symptoms, chest pain, bleeding, nahihirapan lumunok, masakit lumunok, we would do endoscopy. Pero pag diagnose ng GERD, pwede naman by symptoms o if they get better with medications, diagnostic na yan. So, ang indication sa akin para sa endoscopy is once, pag medyo matanda na yung pasyente, 40 to 45, kung may warning symptoms, or if the patient does not seem to be getting better with medication. But in terms of diagnosing GERD, hindi kailangan magpa-endoscopy para ma-diagnose ang GERD. Okay, so intermittent fasting means you eat only 8 hours a day, di ba? It depends on. I don't think it will aggravate or trigger GERD. Kasi most often you will have GERD only after eating, drinking certain types of food. So I don't think there's any problem with intermittent fasting and having GERD. Now, if you develop symptoms, you may have to modify, no? You may have to go into small frequent feeding or water, no? Kasi drinking water helps kasi it washes away whatever is being what is refluxing into your esophagus. Yes. Meron tinatawag na urea breath test. So may bibigay sa inyong doktor that you will breathe into, and then it will be sent to a laboratory. But there's now a faster way, which is a tinatawag na stool antigen test. So dinidetect yung H. pylori sa dumi ng pasyente. Pero ginagamit namin ito, ako at least in my practice, I use the stool antigen or the urea breath test for determination kung na-eradicate na yung H. pylori. So what I do is for all of the patients that undergo endoscopy with me, I will always check for H. pylori. Pag positive sa H. pylori, I will treat them with a regimen for H. pylori. Then after therapy, I will take them off the medications for 1 month and then check for eradication. Kasi dapat na-eradicate ang H. pylori because H. pylori infection of the stomach is a risk factor for the development of stomach cancer also. Hindi naman ganun kadelikado, pero dapat hindi rin papabayaan. Madalas na bumabalik, of course, depende depende sa age. Pag medyo matanda, I will investigate. Pag bata-bata, I will start on treatment. Tapos titignan ko lifestyle. Are you a smoker? Do you drink alcohol? What are your dietary habits? Are you under stress? No, may mga nagsasabi na pag nagtatrabaho sila, may symptoms sila. Pag nagbabakasyon, walang symptoms. So, kasama na sa lifestyle yon. We have noted in the Philippines, dati kasi ang GERD hindi ganun ka-common. No? But we noted in the past 5 years, no, na tumataas, or even 10 years, na tumataas ang incidence ng GERD among Filipinos, especially among the young. And as I mentioned earlier, I have a lot of BPO patients who have GERD. No? It's because probably of their lifestyle also. They have irregular sleeping habits, irregular eating habits. Then of course, yung lifestyle na smoking and alcohol intake. Yes, no? Pag may bitter taste, ibig sabihin bumabalik yung acid sa bibig mo. Now, especially if you're diabetic, kasi pag may diabetes, nagkakaroon ng nagkakaroon ng irregularity sa function ng esophagus, ng stomach. So, may risk factor for development of GERD. So, I would suggest that you consult your physician, baka kailangan ng gamot para sa GERD and other medications to improve yung motility ng esophagus at stomach mo. But yes, if you have a bitter taste in your mouth, ibig sabihin, nagre-reflux yung acid into your mouth. Yes, there is a risk, no? Pag chronic GERD, pag hindi gumagaling, kasi in any process that causes injury and repair, no? Chronic injury, tapos may repair, injury and repair, that is a risk factor for development of malignancy. So that is why in patients who have chronic symptoms, we maintain them on medications and then we regularly do endoscopy and do biopsies of the esophageal junction just to make sure na hindi nag-iiba yung histology ng esophagus. But yes, chronic GERD is a risk factor for the development of malignancies for that matter.
Also, another question from Nadia. When should we take antacid versus H2 blockers versus PPI?
Okay. Ang antacids is best given after meals, no? So, for relief of symptoms. Yung H2 receptor antagonists, they can be given once or twice a day. Normally, dati, pag ginagamit ng H2RAs, we recommend giving it at bedtime. Bedtime because it helps to decrease the acidity of your stomach in the early morning hours. Ang mga PPIs naman, they have to be given 30 minutes before breakfast. Why 30 minutes before breakfast? Kasi ang PPI, dapat binibigay na habang wala pang acid ang stomach. Kasi yung mga PPIs, nadi-deactivate ng stomach. So, dapat mabigay siya 30 minutes bago kumain, especially in the morning. May mga ibang gamot naman na PPIs, ang mga bagong PPIs na pwedeng bigyan ng kahit anong oras. But lahat ng mga traditional PPI should be given 30 minutes before breakfast. It depends, no? Baka kailangan bumalik ka sa doktor mo para ma-re-evaluate ka. Baka naman hindi acid ang problema. So it depends on your symptoms. Kung hindi gumagaling, it is time for you have to go back to your physician para re-evaluate ka. Baka kailangan, sabi ko, no, pag ganyan, we may do endoscopy to find out kung meron talagang problema yung stomach mo, or we may have to do other tests such as an ultrasound. Baka naman gallbladder problem, or baka naman kasi pwede ring large intestinal problem yan. So, kung hindi gumagaling sa gamot, dapat i-re-evaluate ng physician. Mas nakakatakot yan pag may ammonia. Kasi pag ammonia, ang problem dyan is baka may liver problem siya. So, pag may liver problem, pwede nag-aamoy ng ammonia. So, I would be careful about that. That patient has to be evaluated by a physician. Especially kung merong diabetes or may liver problem. Kung nag-aamoy ng ammonia siya, that patient has to be evaluated properly. Okay, that is a problem. No? What we recommend is first is voice rest. Tapos kasi baka kailangan i-evaluate ng ENT para makita kung may injury sa voice box mo, sa larynx, no? Kasi minsan yun nakokos pag mayroong chronic acid reflux, pwede nakaka-injury sa larynx. So, voice rest, pwedeng gargle with warm water and salt twice a day. You can try the other antiseptics, no, yung mga mouthwash that are available over the counter. Then if you can continue taking your PPIs as needed if you find it helpful. Ang traditional GERD surgery is what we call fundoplication. Ang ginagawa yon, ni-strengthen yung lower esophageal sphincter. Tapos may ginagawa na rin ngayon na endoscopic fundoplication. Tapos meron ginagawang radio frequency ablation. Pero these are rarely done now Kasi ngayon ang nangyayari pag let's say pag hindi gumagaling, no, pag may symptoms at hindi gumagaling in spite of medications, we refer them to another specialist, no. Ang ginagawa, mini-measure yung acid talaga sa esophagus at stomach, saka mini-measure yung pressure before we do anything else. Yun, that is endoscopic fundoplication. But I am not aware if it can be done in the Philippines. So instead of surgery, ang lalagay transoral, so it's through the mouth, through the esophagus, and there are certain mga therapeutic endoscopies are able to do this. Pag inatake sa gabi, some gastroenterologists do is to add a H2 receptor antagonist at night. And of course, try to find. I encourage the patients not to eat too much at night, not to lie down immediately or elevate their heads. Uh, they can try. Some gastroenterologists will double the dose of their PPIs. So sometimes I would double the dose of the PPIs, or and some endoscopists would add an H2 receptor antagonist at night before going to bed. Pero yung mga gabis ko na minention ninyo is best given after meals.
Thank you very much um, for your time and your expert giving your expertise to everyone.
Okay, so thank you very much and stay safe, everyone. Goodbye.